preparing and placing babies and toddlers for sleep, and ensuring the sleep environment is safe, clean and hygienic. Let's start by checking the cot is safe. Cots have been associated with fatal injuries in children under 12 months old. Young babies are vulnerable to suffocating or choking, and toddlers are at risk of injury from falling while trying to climb out of the cot. The ideal place for a baby to sleep is in a safe cot that meets the current Australian standards. First, look for the Australian New Zealand Standards label. Check the locking devices and stability of the cot before you use it, and make sure there are no missing or damaged parts. The cot shouldn't have horizontal bars or footholds your baby can use to climb out. Make sure the height of the cot and the spaces between bars meet the required Australian standards. Next, we will check that the mattress is safe. Check the mattress is clean, firm and flat. The baby can get stuck in the gaps between the mattress and the cot if the mattress is too small. The mattress should fit snugly into the cot, with no more than a 20mm gap between the mattress and the sides or ends. If you can fit 2 fingers in the space, then the mattress is too small. If using a mattress protector, make sure it is strong, well-fitting and clean, with no tears or loose parts that could be a strangulation hazard. Soft toys may look cute, however they pose a significant suffocation risk to baby. Remove all toys from the cot. Bulky and very soft bedding is not recommended and should be removed. Remove any cot bumpers, sheepskins, pillows and doonas. These items may cover the baby's face or obstruct the baby's breathing. Remove any loose items that may be a strangulation hazard. These include mobiles, cords, curtains within reach of the child, as well as amber teething necklaces, dummy cords, or other jewellery and clothing that may cause strangulation or injury. For toddlers or young children sleeping on stretchers or mattresses, ensure they are placed top to tail so the child does not directly face into another child. Stretchers should be wiped with warm soapy water after each use and air dried. Cots need to be hygienically cleaned before and after use, for example between children or if soiled, otherwise weekly. The services should keep a chart of when these are cleaned. We will now look at how to check linen is clean and appropriate and the sleep environment is safe. Check that baby has clean bed linen, preferably their own that has been brought from home. If using the services linen, this should be freshly laundered. Make sure that the bed linen suits the temperature of the environment. For example, in summer, use cotton sheets. In winter, you may be asked by the family to add a blanket. To reduce the risk of overheating, always make sure the baby is dressed in suitable layers of clothing. Less layers in warmer summer months and more layers in cooler winter months. Ensure the baby's head is uncovered. Remove any hats, beanies and hoodies to reduce the risk of thermal stress and overheating. Lastly, ensure the room is not too hot and not too cold, and that the room is well ventilated. This may require you to adjust the reverse cycle air conditioning or adjust windows and blinds to provide cross ventilation. Lower the side of the cot to prepare and place the child for sleep. Make sure sleeping bags have no cords or hoods. And lastly, always use safe manual handling techniques when you are lifting babies and toddlers into the cot. And make sure to watch a manual handling video. Place the baby in the cot on their back, never their tummy. Once babies can freely roll over and move independently, they will find their own preferred sleeping position, usually around 5 to 7 months of age. Place the baby with their feet touching the bottom of the cot, and blankets and sheets go across the chest under the arms of the baby. This prevents the baby wriggling further down the cot and their face becoming covered with bed linen or a blanket, which in turn is a suffocation hazard. Always remove dummy cords and chains, as they are a strangulation hazard. You need to have respectful interactions with the baby and follow their individual sleep preferences, while providing an environment that is conducive to sleep. To do this, you will need to be familiar with each child's settling and sleep preferences. Depending on the individual child, you may play relaxation music, sing soft, calming songs, and talk to the baby calmly. Comfort the baby if unsettled during this routine time. Some babies may need rocking and then placing in their cot. Every baby settles to sleep in their own way, and it is important that you discuss the baby's routine with their main caregivers. Once the babies are asleep, you need to ensure all sleeping babies are checked regularly. Babies and toddlers should be checked physically every 10 minutes by entering the cot room and physically checking each baby. This should be recorded on the sleep chart. Sudden unexpected death in infancy, or SUDI, is a broad term that covers both sudden infant death syndrome, or SIDS, and fatal sleeping accidents. Most SUDI deaths occur in a sleeping environment. SUDI is the main category of unexpected death of babies aged between 4 weeks and 12 months in Australia. When these deaths are investigated, they're often found to be one of the following: fatal sleeping accidents. This is when investigations show the death was caused by an accident during sleep. Sudden infant death syndrome, or SIDS. This is when investigations can't find a cause of death. Sometimes SUDI can be explained by a serious illness or a medical condition that the baby was born with. There are known risk factors to SUDI, including the baby sleeping on their tummy or side, the baby sleeping on a soft surface like a soft mattress, the baby sleeping with loose or fluffy bedding like sheepskin or lamb's wool, or with pillows, soft toys or cot bumpers, the baby sleeping with face or head covered, sleeping the baby in a cot that doesn't meet the Australian-New Zealand standard, exposing the baby to tobacco smoke before or after birth, co-sleeping with the baby, letting the baby get overheated, for example when the baby wears too many clothes or a hat or beanie to sleep. There's no known way to reduce the risk of SUDI for babies who die suddenly and unexpectedly because of illness or a medical problem. This video has demonstrated the correct method for placing babies and toddlers to sleep, ensuring the sleep environment is safe, clean and hygienic. Settling babies to sleep is a skill that takes time to master, and you are encouraged to practice these skills until you are confident. For further information, consult your learning materials or access this link.